Hi everyone, I am Dr. Ramprasad, your orthopedic specialist surgeon. In our routine orthopedic OPD practice, we see a lot of patients who come up with this knee arthritis problem. In fact, 50% of the patients of our OPD constitute this knee arthritis problem. And the common question these people pose to me is that, is my knee arthritis completely curable with medical treatment? Actually, to be frank, this is a very complex question and the answer is not so simple. So in this YouTube video, we'll try to decipher answer to this complex question. Before trying to get an answer to this complex question, we will try to just learn a few points about knee arthritis. Broadly, if you see knee arthritis, it can be grouped into two categories. The first one is rheumatoid arthritis, which is basically an autoimmune disorder, and the second one is osteoarthritis, which is age-related degeneration of the cartilage. So once we look into the rheumatoid arthritis picture, basically this autoimmune disorder means the immunity, which is the bad fighting against the diseases, the immunity which has to fight against the external microorganisms which needs to protect our body, that immunity attacks our own tissues. In rheumatoid arthritis, what happens is the synovium, it is actually a protective covering around the knee joint, it is attacked by our own immunity. So it starts with this synovitis. So once the stage of synovitis is florid, the autoimmune attack spreads to the deeper tissues such as bone, cartilage and other soft tissues, menisci, ligaments and etc. So as physicians, we try to halt rheumatoid arthritis in the early stages of synovitis with disease-modifying anti-rheumatic drugs. These are simply called DMARDs and short-term glucocorticoids, that is the steroids. So to be frank, when a patient comes up with the stage of synovitis in case of rheumatoid arthritis, usually it's reversible. You can reverse it. You can halt the patient in the stage of synovitis itself. But once the disease spreads to the deeper tissues of cartilage destruction, bone erosions and other soft tissue involvement, usually the picture is irreversible. You will have some irreversible damage. So it is always advisable to start the patient on this DMARDs, disease modifying anti-rheumatic drugs and short-term steroid medication to achieve a remission, to halt the progression of the arthritis picture. But when we see the other end of the spectrum, which is osteoarthritis, here the basic pathogenesis is age-related degeneration of the cartilage. So once the cartilage gets destroyed, to be frank, we need to remember one point. The nature-formed God-given cartilage is of first grade quality, that is hyaline cartilage. But once it gets damaged, it is usually repaired by a second grade cartilage which is known as fibrocartilage, which is of somewhat inferior quality to the hyaline cartilage, which is nature-given or God-given. So the basic pathology is age-related degeneration of the cartilage. It usually progresses through grade 1, 2, 3, 4. To be frank, when a patient comes up with osteoarthritis in grade 1 and 2, you start treatment with glucosamine supplements, collagen supplements or on and off painkillers, physiotherapy and exercises. Usually what we say is the arthritis is reversible because you will have only small amounts of destruction of the cartilage, say 10 to 20%, and you have reparative mechanisms working and the fibrocartilage really develops and the patients can usually manage. But when it comes to grade 3 and 4, the stages of osteoarthritis, usually what we say is the idea is not complete curability of the disease. It is the basic idea of the treatment is to halt the progression of the disease, because we know that osteoarthritis is not completely curable. So our basic idea of the treatment is to halt the progression of the disease. So when a patient comes with grade 3, you don't want the patient to go into grade 4. When you see a patient with grade 4, you don't want him to progress too fast to come up with surgery. Basically, we address those grade 3 and 4 patients with the same glucosamine supplements, collagen supplements, on and off painkillers, medicines and physiotherapy. And nowadays we are advocating more towards PRP injections, hyaluronic acid supplements. But once the patient is really debilitated and he is not able to do his routine daily activities, and he's so painkiller dependent, then we need to go for surgeries. If the patient is more than 55 years of age and if he is surgically fit, then only joint replacement surgeries, or if the patient is of younger category, we might need to look at high tibial osteotomy to save his knee joint. So that is all a different category of treatment. So I mean to say that if you come to osteoarthritis grade 1 and 2, you can maximize your curability, but once the osteoarthritis stages reaches grade 3 and 4, it's usually irreversible. The idea is to halt the progression only. I think finally from this YouTube video, you must have taken some message from this discussion that knee arthritis, if it really, whether it be rheumatoid arthritis or osteoarthritis, if you look at the later stages of the disease, it is irreversible. But if you come up early in the disease, with the present medical advancements, we can really achieve curability for your pathology. Thank you for watching our video. Let's meet on another medical topic in the next YouTube video. Until then, signing off, your Dr. Ramprasad.